Welcome to This Explainer. Today, we're diving into one of the most intricate, vital, and frankly, awe-inspiring factories on the planet, your own gastrointestinal tract. Stretching up to 30 feet long in the average adult, I want you to think of your digestive system not just as a bunch of organs, but as a highly coordinated engine. It's literally the foundation of your survival. I mean, it works silently around the clock, turning the food on your plate into the cellular energy that actually powers your life. How cool is that?
But here's a number that should really make us pause for a second. Billions. Digestive diseases affect literally billions of people all over the world. We're talking about a massive global-scale issue here. And it's not just a minor stomachache, you know? This spectrum ranges from mild everyday things like acid reflux or occasional constipation, all the way up to severe, life-threatening failures. Things like gastrointestinal bleeding, acute pancreatitis, or liver failure. It is a system we all completely rely on, yet it's surprisingly vulnerable.
So here's our roadmap for this explainer. 1. Meet your digestive engine. 2. When the system fails. 3. Recognizing GI medical emergencies. 4. Diagnosing and treating disease. And finally, 5. Protecting your gut health. Let's get right into it.
Section 1. Meet your digestive engine.
Okay, think of digestion like a giant, perfectly timed assembly line. It all starts with ingestion and swallowing in the mouth and esophagus. Chewing and saliva basically kick off carbohydrate digestion right then and there. Then the food travels down via these muscular waves called peristalsis right into the stomach for gastric digestion. This is where gastric acid and enzymes like pepsin break proteins down into this sort of workable slurry. Next up is the really crucial step. Nutrient absorption in the small intestine. This is where the magic happens. Using these tiny, finger-like projections called intestinal villi, your body extracts vitamins, minerals, and energy. And finally, the large intestine handles water absorption and forms whatever waste is left over for excretion.
But you know, this assembly line definitely doesn't work alone. It heavily relies on a whole network of accessory organs. Think of them as chemical plants. Your liver, for instance, is this massive detoxification center that also produces bile and stores vital nutrients. The gallbladder? That acts like a storage tank, just holding onto that bile until it's needed to break down dietary fats. And then there's the pancreas. This thing is a dual-threat powerhouse. It pumps out crucial digestive enzymes, like lipase and amylase, while also managing your endocrine system by releasing insulin to regulate your blood sugar.
Which brings us to Section 2, when the system fails. Instead of getting bogged down in some endless textbook list of diseases, I find it really helps to group this massive array of GI conditions geographically. Up in the upper GI tract, you might run into the acid backwash of GERD or the really painful sores of peptic ulcer disease. Down in the lower GI tract, the factory can suffer from conditions like celiac disease, colorectal cancer, or irritable bowel syndrome. Over in the hepatobiliary zone, so the liver and gallbladder, it can be struck by viral hepatitis or those incredibly painful gallstones. And the pancreas itself can suffer from acute or chronic pancreatitis, which severely disrupts the flow of those crucial digestive enzymes we just talked about. Now, this next point brilliantly illustrates a key distinction that actually confuses a lot of people when we talk about the lower GI tract. Notice the difference between IBS and IBD. Irritable bowel syndrome, or IBS, is a functional disorder, meaning it causes very real pain, bloating, and discomfort, but it doesn't physically, visibly damage the digestive tract. On the flip side, inflammatory bowel disease, or IBD, which includes things like Crohn's disease and ulcerative colitis, that involves structural, destructive inflammation, and that can cause severe, long-lasting damage to the intestinal walls themselves.
Section 3. Recognizing GI medical emergencies.
Okay, the absolute crucial point here is that these specific red flag symptoms are non-negotiable emergencies. Seriously, if you or someone you know is vomiting blood or experiencing massive rectal bleeding, that is a catastrophic failure of the line, period. A board-like, incredibly rigid, and severely painful abdomen, that can signal a perforated bowel. Jaundice, which is that yellowing of the skin and eyes, especially if it's accompanied by confusion, points directly to acute liver failure. And a high fever with severe dehydration can actually indicate sepsis, which is a deadly, system-wide infection. In any of these scenarios, the engine is failing fast, and immediate emergency medical care is literally your only option.
Let's move on to Section 4, diagnosing and treating disease. To spot issues ranging from bleeding ulcers to an H. pylori infection, doctors rely on advanced imaging, laboratory tests of your blood and stool, and most notably, the endoscopy.
And the really amazing thing here is that gastroenterologists don't have to guess what's wrong anymore. By sending a tiny high-definition camera on a flexible tube directly into the GI tract, they can literally see inside you in crystal-clear high definition. They look directly at the lining of your stomach or your colon, they instantly spot cancers or areas of inflammation, and they can even grab tiny tissue samples called biopsies for microscopic analysis later.
Now, when it comes to treatment, we have to match the right tool to the specific breakdown. So we're contrasting medical management with mechanical, surgical fixes. For instance, while mild gallstone symptoms might be managed medically with hydration and meds, a severe blockage, that requires a cholecystectomy, the actual surgical removal of the gallbladder. Similarly, GI cancers might be fought chemically with chemotherapy and biologic agents, but they also very often require a bowel resection. That means physically cutting out the damaged section of the factory line and reconnecting the healthy parts together.
And here is a surprising fact that a lot of people overlook. Fixing the engine doesn't just magically stop at the operating table. If you've had major abdominal surgery, your core muscles and your breathing mechanics are significantly compromised. So targeted physiotherapy is absolutely critical for full rehabilitation. Things like early mobilization, deep breathing exercises, and core strengthening, they prevent nasty post-operative complications like pneumonia, and they help you regain your functional independence safely.
Section 5. Protecting your gut health.
It's the ultimate question, right? Can you control your digestive fate? Well, while genetics and age definitely play a role, asking this question transitions us perfectly away from clinical hospital treatments and into the powerful, everyday lifestyle modifications that are entirely in your hands.
By adopting these protective habits, you basically get to act as the ultimate mechanic for your own body. It all starts with the raw materials. A high-fiber, balanced diet that's rich in prebiotics and probiotics to feed your healthy gut bacteria. Limiting alcohol and avoiding smoking will drastically reduce your risk of inflammation and cancers. Maintaining hydration keeps the whole assembly line moving along smoothly, while regular physical exercise actually stimulates normal bowel function. And hey, don't forget preventative medicine. Getting vaccinated for Hepatitis A and B protects your liver, and staying strictly on top of routine colorectal cancer screenings can catch malignant changes literally years before they become dangerous.
Remember, while most digestive diseases do improve remarkably well with early diagnosis and proper medical care, your daily nutritional and lifestyle choices, those are your primary frontline defense. You absolutely don't have to wait for the system to break down to start taking care of it. Just understanding how your body works is the vital first step to keeping it running smoothly.
So, I'll leave you with this. What small change will you make today to fuel your intricate digestive engine for a lifetime? I mean, maybe it's just adding an extra serving of vegetables to your plate, drinking a bit more water, or finally scheduling that screening you've been putting off. Your digestive tract works tirelessly for you every single second of every single day. Isn't it time to return the favor? Thanks so much for joining me on this explainer, and hey, here's to your lifelong health.